And when this individual might show up in your office or might be at a dinner party and you're seeing them in the community, at the bar, whatever you are, they have symptoms that might overlap between those. But we often gravitate immediately towards the post-traumatic stress piece. If they don't like to be in crowds, if they maybe are nervous about loud noises, those are actually symptoms that can also, we also see in individuals with traumatic brain injury.
Wow.
So that overlap makes it a real challenge.
It seems like TBI is sort of misunderstood amongst the public. So can you kind of clear it up a little bit in that what is your procedure to make a TBI determination once they come in if they decide they want to visit?
Sure. So I think, when we think about traumatic brain injury and trying to diagnose and identify the injury, first we need to make sure that somebody's actually had an exposure that makes sense. At times I'll talk with individuals who might be concerned about having a traumatic brain injury, but the forces involved with whatever collision maybe or whatever bump they had, it just doesn't make a lot of sense. So there's a lot of education there about what constitutes a potential injury. That's sort of number one. Then we start to think about, really we focus on function. So the brain is organized into different networks. Those networks subserve things like, can you balance? Can you track an object with your eyes? If we think about an athlete, like this is what an athlete's doing, right? They're really rapidly adapting to a dynamic movement environment, and they're balancing, they're tracking with their eyes, they're making split-second decisions cognitively about what they need to do. So the brain has networks that control all of those different functions. And if an individual has a mild traumatic brain injury, those networks are disrupted. But those networks are disrupted in a different way for everybody. It's a very variable injury. Who knows where your networks may be affected? So what we do when we're trying to diagnose this injury is we cast a wide net. We're looking at how are you functioning cognitively. Not just how is your memory on a written test. How's your memory when we put you in a distracting environment? Maybe your function drops then, which is important depending on what you're trying to do in your life. How are you tracking objects with your eyes? How is your balance? And then there is a network in the brain that controls emotional regulation. It's called the limbic system. It's as real and organic as the network that controls eye movements. And so folks with brain injuries have emotional dysregulation because that network can be involved. And so we look across functionally all of those domains, and then there are criteria for establishing there was an injury or an exposure that might have led to a TBI. We're seeing functional deficits that fit with TBI. And I think to highlight, a lot of folks go to the doctor and they say, I think I might have had a traumatic brain injury. I need an MRI. That's a great example. Unfortunately, imaging right now, about 96% of individuals with a known mild traumatic brain injury will have normal imaging.